Hello, everyone, and welcome to my CHN podcast, Health Conversations Without Barriers. This is Mariela in the marketing team.
Hi all, this is Olga.
Hi, I'm Lulu.
And today we have a very special guest. It's her first time here, so give her a welcome. Ty Starkdale, our social determinants of health manager at my CHN.
Hello, everyone. Again, I'm Tyrasia Stargel, but I tell everyone to call me Ty. I am the new SDOH manager here at Community Health Network, and I'm so excited to be here.
Thank you for being here. So it's a time of the year, again, when everyone's renewing their health insurance, right? Making sure that they and their family are covered. Today, we're going to talk about something that is happening and that is very important for other healthcare centers right now to start implementing within their communications with their patients. So, Medicaid is one of the largest and most largest used healthcare coverages here in the United States. And right now, they're going to a re enrollment phase. As of October 2022, Medicaid has a coverage of 84.3 million people, right? So it's a very small number of the population.
Mhm.
And right now, a lot of people don't know that they have to re enroll. So we have Ty here and to tell us a little bit more about what Medicaid is and how is it funded.
Okay, so that's a really good question. People would be really surprised at how many individuals don't know the answer to this question. So, Medicaid is a state and federal cooperative venture. It provides medical coverage to eligible low income or no income households. And so, all this money that we receive for that basically is an accumulation of tax dollars, and it trickles from the state and federal level, and they divvy everything up and put it into different funding pockets so that we know how to utilize those funds.
What would be like let's say, what would be an example of a low income or no income household?
So, if no one in the home is working, or let's just say someone in the home may receive like social security disability, or some maybe a TANF member of the household. They don't really receive a lot of money in the house, and so it may put them, depending on their household size, at that federal guideline for who can receive Medicaid.
So let's say it's a single mother and she's working. She works, right? Let's say she
Mhm.
works, but she works a like a fast food job, right? And it's
Right.
like minimum wage. And she might have two or three children. Maybe one of them is going to college, and then the other ones are still in school. That would be maybe one example for family
Right.
that
Exactly. So, and it's not even just a matter of a fast food joint. We have people who work so many jobs where um, it's either at minimum wage or it's a little bit above minimum wage, and their jobs probably don't provide any kind of medical coverage, or medical coverage that extends far enough for families to be able to have adequate health care. People don't even know that they can have a primary insurance through their employer or through the marketplace, and actually still apply for Medicaid if their primary insurance doesn't cover enough, if qualified.
okay. So my understanding was that usually if a job is more than like 50 people, shouldn't they offer some type of healthcare? That was my understanding.
Yeah, and so they will offer it, but it may not be enough coverage, that based on the plan that the employer chooses, it may not be enough coverage for, let's say, an individual who has a household of, you know, 6 or 7 people, where that insurance may actually super exceed how much they can actually contribute to their home. So there is actually a lot of, it gets pretty tricky when you go and you apply for Medicaid benefit. And honestly, when people get on the phone and they call that 211 line, they'd be surprised how many answers they can get to the questions they have very, very quickly.
So, Ty, I do have a question. So you mentioned real re-enrollment. How do I know if I need to re-enroll, or is that for everybody with Medicaid that they need to be re-enrolled, or who's needing this?
So basically, your Medicaid is going to last you for about 12 months if you are already enrolled. And so you don't want to wait until your Medicaid coverage runs out. Um, the, there is usually a letter that is sent out in the mail, or you will get a notification on your Texas benefits account that will let you know that it's time to re-enroll. To my knowledge, I believe that that happens at least 60 days ahead of time. But always be sure to check um, and make sure when you go into your account, or even if that person's not tech savvy, again, I'll always refer call 211 Texas. They're going to get you connected to the right individuals to talk to. So that way you can find out whether or not it's time for you to re enroll. But most people usually get a letter in the mail saying, hey, it's time to re up your benefit. Go
And
ahead.
s- and speaking a little bit about that, we you did mention that it's a state and a federal like collaborative. So I know from state to state the benefits might vary. How does that work in Texas? Like how does someone know what would they would qualify for?
Okay, so basically, in for the state of Texas, you would go to the Texas Health and Human Services Commission. Um, they're going to have all the information that you need about Texas benefits specifically. Of course, we have programs such as Texas Healthy Women's and CHIP perinatal. There are a gamut of services that are provided specifically um, to Texas. Also, our thing here in Texas is really about improving the health of individuals and families who may not otherwise have health care. And that could be due to a high cost of health care or just limited access to private insurance. So, the Medicaid program in Texas, one thing people have to be aware of, though, is that it's not extended to adults, like singular adults. Um, you have to be a caretaker of a young child or someone who is disabled in the state of Texas in order for you, if you are over the age of 18, to receive Medicaid as a single individual.
I think that's a good point that you mentioned because I'm not sure if a lot of people know that Medicaid is for like seniors and then if you're taking care of someone. And there's a question I have on here that's also related. You mentioned CHIP as well. So they're usually like hand in hand, Medicaid and CHIP. What's the difference?
Well, the biggest difference is that CHIP focuses is on the child. And so that's why you have CHIP and CHIP perinatal. So the mother, because she's pregnant, will get the CHIP perinatal simply because she is pregnant and she needs that insurance. And she probably made a little too much to get Medicaid, the straightforward Medicaid. And so then it makes her more applicable for CHIP, which is still very low cost, very inexpensive. Um, I'm a big fan of CHIP because of how much access it gave for healthcare for families who wouldn't have otherwise qualified for Medicaid.
Yeah, one time, I know this is, and I don't know if you remember, Olga. One time I showed you guys how much a family has to make, how little they have to earn to qualify for Medicaid, and that's a lot. That's what a lot of things happen. It's like a lot of people I've noticed that you have to be under a certain poverty level, right,
Yeah,
for Medicaid. And then I, for example, I can say I was a chip kid. I like we were a chip kid like household,
right.
so I understand the struggles. And to me, it was like the healthcare that we got under chip. It was good. Like
Yeah,
it was good. Obviously, it's not like as someone with insurance, like you don't go to the places people that have insurance, but definitely there was like it was something, and it makes you so much healthier as a kid.
You make a really great point because I mean, I myself used Medicaid and CHIP for my kids when I was in my early, well, working on my master's degree. My husband and I both were in school and pushing it, and um, the great thing was that Medicaid provides all these different plans. Okay, so there's 5 options that you can choose from on their plan. One of them, which I'm kind of partial to, is the Texas Children's Health Plan because my children saw a Texas Children provider. And so, and I love, love, love those doctors, and those kids still got adequate care. It was almost as if I didn't have to worry about a stigma of coming in because I had Medicaid. I had a Texas Children's Health Plan, and that was all that they needed to know. But there are 5 plans that people can choose from: Community Health Choice, Molina Healthcare of Texas, the Texas Children's Health Plan, um, United Healthcare Community Plan, and AmeriGroup. So all of those plans provided to you are all going to determine which provider you're going to be able to see. But people don't even know that they have the options to choose which plan they want and which provider they get to see. Same thing with the dental. The dental offers 3: United Healthcare Dental, MCNA Dental, and DentaQuest. So if anyone were to go online, whether they're re-enrolling or they are um, a first time applicant for Medicaid, you have 3 ways you can go on to apply or re-enroll. So you go to yourtexasbenefits.com, which they typically prefer because everybody is moving digitally now, so things become a little bit easier um, to do things online. But some people may not have internet access, so in that case, you can call the HHSC toll-free number, or you can also mail in an application. So, but if you do the online app or if you call in, you can even pick the provider that's closest to you. So the options are there.
Now, this is great information, Ty, and this is so important because we all know how high the pricing for healthcare is here in America, which, a lot of people it might prevent them from actually taking care of their health. So this is very important. And I do know that at Community Health Network, we provide different support and help with Medicaid, Medicare enrollment. Could you tell us a little bit more about
Sure,
that?
sure. Our teams across the board are all collaboratively working together to make sure that any patient that needs to re-enroll can. So eligibility, outreach, SDOH, and the HIV teams, all of us are trained to help patients re-enroll or enroll for Medicaid. And so all they would need to do is just bring their required documentation, which usually is limited to like your ID and your social, just to kind of verify who you are. Um, and go from there. There may be some other documents that are needed, but that's all kind of based upon um, who you are, what your circumstances are, if you have children, and the like. But usually it'll tell you, once again, online, yourtexasbenefits.com, what all you need in order to complete the application. And also, my CHN does a really good job at providing the resources and letting everyone know what they need to have before they come in. All you have to do is just give us a call, or if you're close by, you can come in and ask someone at the front desk. They'll be more than happy to answer those questions.
Usually, like how you said, they can either, go online, right? And they can even call 211, correct? Okay. The
Right.
other thing is, for example, we do have a lot of patients that we help them enroll themselves into Medicaid. maybe
Mhm.
their kids, Title V, all the things. If you feel comfortable with us, don't be afraid to reach out to us. We,
Right.
like Ty said, we already have a team. We have a big team that they will be helping you to re-enroll. Um, and one of the things that I know a lot of people want to know is what happens if they don't re-enroll. Do you think the government's going to extend it, or what do you think is might happen?
So we're definitely no longer in a place where the government is going to automatically extend the care. If you don't re-enroll, you could risk not um, getting any coverage anytime soon, or having a lapse or gap in your coverage. So that's why it's really important to kind of check on those deadlines to see when everything needs to get in and get in on time. I mean, people have to think about it. Well, we know many people are in need, and some people, lack the access to internet or transportation. Um, if you need help with your Medicaid application, there is someone that actually can come to your home um, through 211 to help you complete that application. So if they can't come to my CHN, someone can come to them in their homes to help them with this application. So this is kind of a testament to how much we want people to have health insurance so that they can get in and see their doctors and stay healthy and be healthy and stay healthy.
Yeah, I know sometimes, and I might be speaking from my point of view, but sometimes getting all that paperwork and seeing everything that you have to apply might be overwhelming, because
Yeah.
sometimes I see that and I say, "Ah, I don't want to do it today." But
Exactly.
letting you know that you can be putting it off, and by the time you remember, the deadline already passed. So I would say just try to be proactive. We understand it can be overwhelming, but we are there. Reach out to us if you need any help. We definitely have someone that can help you.
Yeah.
And anything else you guys want to ask Ty?
Well, before anyone chimes in, I just want to let the listeners know as well. Be sure to not miss the deadline, because it's almost like you have to do a new application all over again, and it kind of puts you at the back of the line. And it's more work to do a brand new application versus the re-enrollment. It takes half the time. So be sure that you're checking on those deadlines and re-enroll when they send you that re-enrollment notification. Anything else for me, ladies?
Well, thank you everyone for joining in. Thank you, Ty, for taking time out of your day and just educating our listeners about how important it is for them to, get the benefits that they need. Um,
And it's not just these are the benefits they need. These are the benefits that they deserve. So remember, anyone that is pregnant, um, they're responsible for a child that's under the age of 18, blind, has a disability, or a family member that has a disability, or 65 years of age or older, and shows a great financial need. You qualify for services. So don't be afraid to reach out. If you need your mental health visits and prescriptions covered, Medicaid is going to do it. You need palliative care, and palliative care needs, Medicaid is going to do it. Even medical equipment. I was able to get a nebulizer from my own child, and a breathing machine, and the like. Um, so women's
actually,
services, pediatric care, like, you can get a lot. Medicaid also is going to link you to your SDOH needs. So if there's other resources that you need, food, shelter, water, you would be surprised how having Medicaid is going to link you to those resources.
I think once I saw that, for older Medicare folks, that
Mhm.
they might just need a phone, just maybe just I forgot how many minutes it was, like 1,200
Mhm.
minutes a month. They're willing, right, to
Yep.
provide those services sometimes.
Yep. They
Okay.
even have another phone now, where it's not a cell phone, it's a home landline,
Mhm.
that's has a very large screen. It's actually been on the market for many years now. I want to say close to 15, but a lot of people don't know that it's there because they don't understand that once they are linked to state benefits, that there are a lot of resources that are available to them. Utilize that 211 line to access those resources because they are there. And sometimes you can even your Medicaid call your Medicaid plan and let them know what you need. And more than likely, they will have an answer for you or know how to direct you to those additional resources.
That's great. Actually, I think we might try to build something like that on our website soon, as long as we can get some of that wording from you. Um,
Of
so
course.
I would say don't be afraid to call us, reach out to us. And thank you everyone for taking the time, to inform our listeners. And thank you, Ty, for taking the time today. We'll definitely be seeing you more here. Um,
Absolutely.
and don't forget to demonstrate your love by sharing this podcast with your friends and family or giving us a review on Spotify and iTunes. Share us with the ones you love and just let us know how we're doing. And until next time.
Bye.
Bye-bye.